Okay, so the audio is on. When moving around the OR as a sterile person, if you need to pass another sterile person, you should do it back to back. What is the rationale for folding the edges of a sterile drape, like a mayo stand cover over your gloved hands while placing it? So, kung mag-fold ka, kailangan mo i-fold ang edge sa sterile drape sa mayo stand cover over your gloved hands as you place it para di ka mabuling, te. Protect your sterile gloves from accidentally touching the unsterile table and beneath. So, naka-video taan ani ma'am. So, pakilantaw na lang. When assisting a surgeon with gowning, how should you present the gown to them? So, diba kay kung kita magsuot away from us, so, kung sila tong pasuoton, away from them na to ang front. So, muna tong i-hold na to siya sa neckline and shoulder area, allowing it to unfold with the inside facing the surgeon. So, katong baliktad bitaw siya paghawid sa surgeon nga neckline. Nadyo ila ato nga procedure. Naka-realize ko. Sakto to siya na procedure. Pero, para to siya sa paghatag sa surgeon. Paghatag na to siya sa surgeon. So, naka-realize ko, nagkamali manggukuan na, ana. So, ako nang i-assist siya. So, yeah. Hold the gown by the neckline and shoulder area, allowing it to unfold with the inside facing the surgeon. Inside facing the surgeon. Oh. When presenting a sterile glove to a surgeon, how should your fingers be positioned inside the cuff? So, katong tanan, 4 fingers nimo kay imuhang use pag open. Insert your 4 fingers into the cuff with your thumbs out. When assisting with gloving, the thumb of the glove should be facing the blank of the surgeon. Kung mag-face ka, mag-assist ka sa gloving, no? The thumb of the glove should be facing the blank of the surgeon. Assisting with gloving. So, mag-assist ka with gloving. The thumb of the glove should be facing the blank of the surgeon. Wala ko kasabutan ni na procedure. Nag-assist ka with gloving. The thumb of the glove should be facing towards the surgeon. So, kung pag-plaster nimo sa gloves, guys, imuhang i-position ang gloves towards the surgeon. Dili, like, kaya maglisod hiwi pang surgeon ana kung asa siya mag-position. Baho lagi. So, kailangan ang katong nasa thumbs kay towards the surgeon. Why is it Why is it important to stretch the cuff of the glove when assisting a surgeon? It is important to stretch the cuff of the glove when assisting a surgeon kasi maglisod siya suot, creating a wide enough opening for the surgeon to easily insert their hand. What is the name of the patient's safety tool used in the OR that is checked at 3 different points during the surgical process? The name of the patient's safety tool used in the OR that is checked at 3 different points during the surgical process. Manan siyang WHO? The WHO Surgical Safety Checklist. So, my question, why is it called WHO? WHO. Muna siya ang pag-verify sa name sa patient safely. Okay? So, who is responsible for ensuring the whole surgical safety checklist is completed? Kinsa ang responsible para ma-complete ang WHO checklist? Ang responsible ana ang circulating nurse. So, WHO surgical safety checklist is a critical protocol used to verify a patient's safety details and is the responsibility of the circulating nurse. So, according to the source of the checklist is executed at 3 different intervals during the operation. So, kanang samanta identify sa patient safety details. So, before the induction of anesthesia, so before pa jud mag-start ang surgical procedure, before skin incision, so diri ask kung unsa ang layer, pinaka-last na layer sa skin sa kuan, which is a very thin nga layer is ang peritoneum. Before the patient leaves the operating room, kailangan na po tayo mag-verify. So, muna siya ang WHO process. This process typically coincides with the endorsement phase where the ward nurse hands over the patient to the circulating nurse while the scrub nurse is preparing the sterile field. During these checks, the circulating nurse gathers and verifies essential information, most importantly, the patient's identity. Nagbasa ka pero makasabot ka? Wala. This process typically coincides with the endorsement phase where the ward nurse hands over the patient to the circulating nurse. The scrub nurse is preparing for the sterile field. So, coincides lang sila, nag-go sila hand in hand. Balik ta sa questions today. Why is it important? Why is it important? Saan naman ni? Who is responsible for ensuring ang circulating nurse? What are the 3 checkpoints of the WHO surgical safety checklist? So, mo ba nito siya katong ask? First is before the anesthesia procedure. Second is before skin incision. And the lastly is before the patient leaves the OR room. The OR. What is the name? So, sakto ba to siya? Yeah. Dapat yung question about counting ba? Counting sa mga instrument. Which wala to na to siguro na appeal diri. Kay lahi na to siya na voice record. So, ato lang na siyang balikan. Ato lang siyang himuan o kuan another set of flashcards. So, during the surgical count, what type of items are typically counted? Aray, mga pangita liya na. Ang surgical counting. What types of items are typically counted? Sponges, needles, and instruments. What is the name of the sterile drape used to cover the Mayo stand? So, not a specific name tong drape na gina-cover sa Mayo stand. Mayo table cover. What a beautiful name it is. The item referred to as a septo in the lecture is used for what purpose? Always assume that you have something to learn about. You can learn something about. Always assume that you can always learn something from someone. So that's a really great approach to life, guys. Okay, dili tayo magpa-distract sa mga Facebook ha. Okay. What the item referred to as a septo in the lecture is used for what purpose? Saan ang asepto? It is used for washing or skin prep. Wala ko kakakuha na. Remember nga, naaday ilana, asepto. Pero siguro nastorya ng asepto. Something about asepto. When opening an individually packed sterile item like a suture, what principle should be followed? Suture, individually packed sterile items like a suture. What item should be followed? Hold the edges of the package only and drop the item into the sterile field. So, better drop. Before beginning the surgical scrub, what 2 pieces of personal protective equipment must be worn before nag-start kag surgical scrub? What 2 pieces of PPE must be used? A mask and a surgical cap, bonnet. Kung wala kay surgical ay nalang pagsugod. In the context of OR attire, what item of personal jewelry must be removed before scrubbing? Unsa man? Wala may klase daw. Sana or. So, unta. In the context of OR attire, what item of PP personal jewelry must be removed before scrubbing? Ang imong watch, girl. Wristwatch. If you are scrubbing and accidentally touch the faucet, what do you do? Go back. You start this entire process over again. The disposable scrub brush mentioned has two sides, a brush side for the nails and a blank side for the skin. Sponge, ang sponge kaysa skin, ang brush side kaysa nails. So that's all for the flashcards. Great job. Can we do a quiz? So wala ta nakakuan og quiz, no? Generates